Welcome to another edition of A Poor Man's Pharmacist. My name is Seth Haslam. I'm a doctor of pharmacy. Last week we covered prescription drugs and some of the vitamin deficiencies that can occur with those specific prescription drugs. Today I'm going to continue that same topic, and we'll cover 4 different drug classes and my recommendations with these prescription drugs is in terms of supplements and things you need to look out for. So the first drug class are corticosteroids. So steroids commonly used for inflammation, for different disease states. They suppress the immune system, but they also have a whole host of other side effects. So common steroids are prednisone, dexamethasone, methylprednisolone, also known as a Medrol dose pack. So if you take these medications for longer than 2 weeks, it's important that you supplement with calcium and magnesium because among other side effects, it can cause brittle bones if you take it for a prolonged period of time. So you need to supplement with calcium and magnesium. I think a typical calcium supplement, 500 milligrams, twice a day is perfectly fine. And any magnesium you could take once or even twice a day if you feel so inclined. Just be aware with magnesium can cause diarrhea, especially if you take too much. The second drug class are oral contraceptives and female hormone replacement. So examples are Premarin, Estrace, oral contraceptives, all sorts of different types. It's important to supplement with B vitamins because oral contraceptives and hormones can inhibit the action of these B vitamins. So it's important. I would recommend a vitamin B complex. Also, I found some recommendations for calcium and vitamin D. Again, a typical calcium, twice a day would be perfectly fine. And vitamin D, the recommended amount that I found was 1,000 to 2,000 IUs daily. It's not always given the strength. It's not always given in IUs. I think it's more commonly given as micrograms. However, you'll be able to find the conversion there on the product. The next drug class are benzodiazepines. So these are medications used for anxiety. Sometimes they're used off-label for sleep, even for restless legs, or as muscle relaxers. So what can happen with benzodiazepines? And examples of benzodiazepines would be clonazepam, diazepam, alprazolam. It's recommended that you take melatonin, 1 to 3 milligrams daily before bed. The reason is because it can throw off your circadian rhythm. Now, melatonin is naturally produced by the pineal gland, and these benzodiazepines can inhibit the production of the melatonin that would naturally set your circadian cycle. So it's important to supplement, especially if you're taking these things for sleep, with melatonin. The next final drug class, are atypical antipsychotics. It has a very strong name. It's not always used for schizophrenia and psychoses, however. They're also used for bipolar, for treatment-resistant depression. Examples would be Abilify, Risperdal. So Abilify is aripiprazole, Risperdal would be Risperdone. It's recommended that you take a daily multivitamin because absorption of vitamins and some minerals can be inhibited with atypical antipsychotics. Also recommended, and you could take a men's multivitamin if you're a man, a female multivitamin if you're a female. It's also recommended that you take vitamin C 250 milligrams to 500 milligrams daily because vitamin C, the absorption of it is also inhibited with atypical antipsychotics. That's all for this week. Thanks so much for your time. Have a great day.